welcome to the feed.
And welcome to Bellows Falls.
Welcome. Happy to be here.
So this is your first time in Bellows Falls.
This is my first time. Yeah,
Great.
so pretty nice now.
Yeah. So tell us a little bit about yourself and where you went to school and how you came to be here.
Yeah. So, as you guys already know, my name is Odigie, one of the podiatrists that work at Springfield Hospital. So, I'm originally from Nigeria, West Africa. Did a good portion of my schooling in Nigeria, but most of my college here in America. So, initially, I started at Southern Illinois University, Carbondale, where I had my bachelor's degree. Then, after then, I got a degree in physiology, then a master's in biomedical engineering. Then I went to Des Moines, Iowa, and that's where I got my podiatric medicine degree. Then after Iowa, I went to Philadelphia. That's where I did my residency. For the first 2 years, the hospital closed, so I had to scramble. Yeah,
really?
Yeah. So the hospital closed. Hahnemann University Hospital in Philadelphia closed in my second year, going to my third year, and so I had to scramble around trying to look for where to do my final year. So I ended up going to Detroit, Ascension St. John's in Detroit. So I finished up in Detroit. So when I finished up in Detroit, I think the goal was, okay, where do I go, to find a job? I'm from Africa, so I like the weather hot.
So you picked Vermont.
I know.
Naturally.
So I know. And so my dream was actually to go to Houston or Georgia, because, I think I moved my wife from Illinois to Iowa. She was like, you keep going cold and cold.
Yeah.
Then, to Philadelphia, then Detroit. And I was like, I think we should go to Houston. So then I could enjoy summer all year round. So, but one of my big, what I was looking for when I was looking for a job, I wanted to go somewhere where there was actually a demand for podiatry, where when I go there right away, I could hit the ground running. And so I've never heard anything about Vermont, So, as a new, graduated residents, I kind of applied everywhere, to Virginia, to Florida, to Texas, and to Vermont, And so I got a message from a lady in Vermont, it's like, do you want to come look at my practice and stuff?
Really?
Yeah.
Nice.
And I was like, there's a place called Vermont, but
I don't know where it is.
Yeah. I was like, let me just go. I had no clue I was going to come to Vermont. Actually, I think my plan was to go to West Virginia too, because West Virginia is a little bit warm too. So
a little bit warmer.
Warmer than this thing. I think that was kind of where I was looking at too. So I came to Vermont. I was like, and I spoke to the lady, and she told me, one of the big things I learned in residency was to work in a hospital. I kind of like working in a hospital, dealing with inpatients and stuff. So I had the practice where I could get a good amount of outpatient and a good amount of inpatient.
Right.
And so she took me around to actually Rutland Regional Medical Center. That was where I went. I met most of the people there, and everybody just seemed nice and stuff. Rutland was kind of a quiet town. I have 3 kids. 2 girls, 1 boy. And so thinking of where you're going to go to school played a big part. So I was just coming from Detroit, Philadelphia,
big cities.
Big cities with, with public schools and stuff, So those were kind of the things I was thinking about then. Thinking about, in terms of, crime and stuff like that, where can I really stay where I could raise my family? And so I think that was how we just settled upon Vermont. And
which is a very non-crime, it's a very safe place.
Very safe, yeah. And I'm surprised, as I say, there are times, my wife say always lock your car door, right? There are times I forgot to lock it, and I'm like, oh no, nobody came in here. I think the only shock coming to Vermont was I assumed every city was the same.
No.
Every city has this thing, a Chick-fil-A.
I don't think any city in Vermont has a Chick-fil-A.
Or every city has a Popeyes,
Nope.
Yeah, and so it's so funny when my wife, I think it was the second day, she went to Walmart and she was like, babe, they don't sell milk at Walmart. So that was a shock for us. That,
it is.
Yeah, in Rutland, Walmart doesn't sell milk. And I think, so she had to go to the Price Chopper or the other place to get milk. So those are some of the...
It's a learning.
It was a
learning curve.
It's like, she was like, if you want to go anywhere, it's like an hour drive, or and people in Vermont know, So, and I think that's another beauty about Vermont too, because one thing I've realized that the patients are very patient.
Oh,
Yeah.
That's an important
Yeah,
thing.
they're
isn't it?
very,
Yeah.
and because they understand that, my friends, they're like, wait, where are you at? I'm like, Vermont. They're like, Vermont? Yeah. So the difference between Vermont and most of the states I've lived in is that in Vermont, if you're going to go to a doctor's appointment, you take the day off. Most times.
True.
Because
Sometimes, yeah.
because
Yeah.
sometimes you don't know the drive, how long you're going to wait and stuff. So you kind of assume that
Yeah,
it's
you have
gonna-
to really
you have to
plan
really
it, yeah.
plan it and stuff. And I think that's why most patients are very patient, especially when you're running behind or a little bit. You're like, okay, we are okay.
They're
And
tolerant to
Yeah,
all
tolerant.
that,
And I've
yeah.
noticed that when I have an appointment too, usually I just take the day off
Mm-hmm.
because you don't know if you're going to be able to make it on time. So just have the day off. And that when you're done, it's kind of no stress. Compared to trying to run back to the clinic and stuff. So yeah, so that was how I ended up in Vermont. And so I was working in Rutland for a while, and someone told me there was a job opening in Springfield in a hospital. And so between this period and time, I think my boss was thinking of retiring. So she was going to move back. She was from California. She was going to move back to California. And retiring means she was going to close the practice. So I was in private practice.
Really? Yeah.
So, and during this period, I think I was, okay, they said there was a job in Springfield. And so I was like, let me apply and see because I kind of wanted to work for the hospital too, just because it's a different flow
Yeah.
when you have a private practice and when you work for the hospital. When you work for private practice, you have to worry about insurance, scheduling and all this stuff. But when you work for the hospital does everything. Just
You just have to worry about the medicine.
about the medicine part of it. And so I wanted that half and half. And so that was I applied for the job, got the job. So I was working at I think 1 or 2 days at the hospital. Then my boss was going to retire, and the practice in Rutland was very, very busy, And so I was like, if she closes this practice, do I just, close it too? Or do I try to open it up again as a new practice? And so I had to make that decision. So I was like, you know what? There's nowhere for our patients to go. I don't know if this is the exact number, but I think there are less than 50 podiatrists in the whole state.
I believe it.
And this is 600,000 people for less than 50 podiatrists, And so if you close shop in Rutland, there's going to be only one podiatrist in Rutland. And I think Rutland is the second
That's
biggest
bigger,
city.
Yeah.
Yeah. And we draw people from even Bennington and stuff. And so,
And probably across from New York.
yeah,
as well.
sometimes
Yep.
they get people even from Bristol. Bristol is kind of on the other side
Yeah,
from me.
yeah.
Yeah, so, and I was like, let me try to open the practice again as, part-time. Then I opened the practice part-time, then took the Springfield job full-time. And as luck would have it, I was able to hire another podiatrist in the
nice.
Rutland
Yeah.
office. And so we were able to, so those patients that my previous boss was seeing, I was able to just move them up to the new provider. So that was a good thing at the end of the day.
So now you work at Springfield Hospital
Correct.
full time.
Full time. Then I do some part-time job at the Rutland, this thing, office. So
But what do you find? What are your challenges in podiatry in Vermont?
So I think the biggest challenge is that most people don't know too much about podiatry.
I would have to,
There we go.
Yeah.
and that's why you're
Yeah. I think most people don't know what we do actually. It's like very few people know. Even in big cities, there's a couple of people in there and out there that don't know about podiatry. And when you have a state when you have less than 50 podiatrists, who's going to spread the word?
Yeah, exactly.
Right. So how many? I don't like very. Couple of them are in private practice. Couple of them are in the hospital, and so in a big city, you have if you go somewhere like Detroit, where I trained at, every strip mall has a podiatrist.
Really?
Yeah, it's like you go to the strip mall, there's a podiatrist or there's a dentist.
Oh.
This is everything, So there's a very big podiatric community, and so as a result, most people know about podiatry. But in a place like Vermont, not much people know. I mean, we're getting the word out there, and the drawback is when people don't know about podiatry, they don't know when to go see one. Correct. And by the time they come see me, it's already too late. Because there are certain things we could have done to prevent, escalating in terms of the food.
Right.
For example, you have what you call a callus. A callus is thickened skin on the bottom of the feet, which is caused from pressure, right? And so if someone can wake up, I have this hard callus on my skin, but I don't think it's anything. They go see the primary and like it's just a callus, put cream and put stuff on that. And over the months and years, they keep having this callus. What happens? A time comes when that callus becomes a wound.
Oh.
Yeah. because when you have pressure keep hitting that place, the skin is going to break down someday. And when that becomes a wound and that patient is diabetic, before you know, within a week, it gets infected. By the time it comes to me, there's not much I can do then, So there are some of them that are lucky enough that we can put them on antibiotics and that resolves it and we just start managing that wound. But if I had seen that patient earlier on when it was a callus, we could get x-rays, see that, this bone is causing the pressure. And what I can do is go in, cut that bone and just let that pressure go off there and the callus goes away.
But would you say that maybe that's PCPs that need to be aware that maybe they should refer to you earlier?
Correct, yeah, but if you know, and I think this is some of the stuff patient tells me, a good number of PCPs don't really look at the foot, except the patient complains about it, right?
Yeah.
If you are going in for high blood pressure, your parents don't look like, okay, let me see your foot.
Yeah. The patient has to drive the
They
train.
have to drive.
Yeah.
So patient have to be educated that, because most, kudos to PCPs that sometimes the ingrown toenails or infected toenails I've gotten is because the patient said, Doc, I think my toe might be hurting. And they're like, let's see that toe. It's a full-blown infection. And so they call me. So most times the patient has to drive that too, because your average PCP appointment, I don't know if they really look at.
Short.
Yeah, it's too short because,
Yeah.
again, in a place like Vermont where you have very few doctors too and a lot of patients, I don't expect every PCP to look at everybody's feet. They'll be there for hours and see maybe 10 patients. And I think that is one of the stuff. But I think some of the PCPs have been very good at, as soon as they see something, they're like, okay, go see the podiatrist. The only other thing is that some PCPs, if they see a wound, by default, they think, let's send you to wound care.
Yeah.
Then, before the patient gets into wound care, it takes a couple of weeks. By the time they get to wound care, then if it's going south, then wound care sends it to podiatry. But ideally, you want to send it to podiatry first to evaluate. And if I say, okay, this is stable enough, let's send it to the wound care, then we can. So those are some of the stuff.
Almost reverse.
Almost reverse, yeah. It's like.
So we were talking before we started the show about how you have a different perspective. Your goal is usually to try to make sure that the patient can keep the foot or the toe or the whatever versus, so you look at, can you talk a little bit about how you look at things differently?
So most times, our patients, they always ask me, what differentiates you from an orthopedic surgeon? Or what differentiates you from a general surgeon? I think one of the difference, again, I don't know the training with the general surgeons and the orthopedics, is that most of us in podiatry, our most emphasis is limb salvage. Is how can we save the foot? How can we save the toe? So sometimes we have like drastic measures, that maybe other specialty might not. We might say, you know what, you have a wound here, let's put a graft that costs so much money. People are like, that's an expensive graft. Why do you have to do that? Yes, because if that graft works and that foot, we're able to save that foot, we extend that patient's life, And I think research has shown that the more you cut foot, limb, leg, you increase the mortality rate of that patient, right? You increase how much work the heart is doing. And so if you can save that foot, that's less work the heart has to do, you decrease the mortality rate. And so that's why, so from a podiatry standpoint, so podiatry, I think, is one of that profession is that we can do diabetic shoes, we can do insoles. That's all part of our training, the biomechanics of the foot. Most other specialty don't really deal with the, I don't think there might be very rare orthopedic surgeons that cast people for orthotics. The reason why is because they're mostly doing other things, They are doing the ankles, they are doing the leg, they are doing the hip,
Right.
But podiatry, we are solely foot and ankle.
And the foot, I like on your Facebook page, your feet are your foundation.
Correct.
And people don't think about that.
Correct. Yeah, because it's like what people don't understand is that when something, I think there are two things that if something goes wrong, it's like you're going to be in the most pain, your teeth and your feet, right? Yeah. So people don't understand is that your foot is what takes your whole weight. When you, your hands don't really take much weight. Your hands is for doing stuff. But when you're walking, you're running, you're climbing, it's all your feet. If your feet is not doing good, you can't do much, And so people don't understand. I always say, most times we're able to say you have some numbness in your foot. Have you seen your PCP? They're like, no. I was like, go see your PCP. And they do their blood sugar and it's like, wow, I think you're diabetic, It's like, you have and this is very interesting because I had a patient, came in with a wound that was not healing, and I was like, this is very interesting. When you see wounds, after a year, 2 years, 3 years, and the wound is not healing, you become like curious as to why that wound is not healing. And I took a sample, and the patient had cancer.
Oh, wow.
Oh, no. Yeah.
From the toe.
Yeah. Yeah.
Right? To today, the patient always thanks. Was like, when that patient came in with numbness in the last, like, go get an EMG, and they found out, oh, your back has problems.
Yeah, because we think, okay, my back hurts, my hip hurts, my knee hurts, I got to do something about that. But if your feet hurt, or if something about the pressure and the way you're walking, if you're not walking correctly,
right,
it goes right up the kinetic chain.
Correct. Because, as you know, there are different types of foot. You have a high arch foot, you have a normal arch, you have a flat foot, right? And so if the foot is not able to, because in an ideal world, the weight should be equally distributed in the foot. Each person should be doing his own work. If someone, for instance, has an amputation of the big toe, then that big toe is no longer there to do the work. And so the rest of the toes have to do the work, right? And if the rest of the toes cannot do the work, it goes up to the forefoot, the midfoot, the ankle, your knees, your hips.
Yeah.
So that's why most times we make inserts for people so that it can help correct that deformity. And as a result, people are like, oh, you made it since my back pain is gone. Yeah, it's gone because now you're working properly. Yeah, so that's correct. Yeah.
So what are some, if people are at home, what are some other normal normal things that you would see besides the diabetes and the
so most times too, it's like ingrown toenails. So the way you cut and I think I see a lot of kids, and most times when they're coming mostly with ingrown toenails, and the first thing the mom or dad is like, they try to dig it out. So those are the things that can cause an infection. So those are one of the common things you can see. And so when I see my patients, like, when you cut your toenails, cut them straight across. And if you cannot cut them straight across, then call either your primary care doctor if you can get into them sooner, or call the podiatrist. So those are one of the key things we tend to see. Sometimes with young kids, spots, sprains too. We deal with that too. And so it's like, if you have a sprain, try to get in somewhere real quick because you don't want something that is there to get worse. So those are kind of some of the key things. And I think the biggest issue is especially my diabetic patients. Those are the key demographic we're trying to pursue and ensure they are doing the right thing. It's like we say, stay out of, soaking your feet in something hot. We've had people that, a glass is broken, look at, especially for a diabetic, this is key. Every day, look at your feet. Someone's like, oh, doc, I cannot get a mirror. And with the mirror, you can see because you might have a small wound and you don't know the wound is there. And before you know it, it's like, doc, this smell. It's like, yes, because you have a wound.
Yeah.
So, and sometimes these diabetic patients are using insulin too. They have needles and stuff. So you have to ensure these things are properly disposed after you use it.
Right.
Yeah, if you're diabetic. Because I can tell you the number of times the patient has come and there's like an insulin needle in there. I'm like, doc, I didn't know that was there.
Wow.
Yeah, because they have no feelings.
Yeah.
And if you don't have no feelings, you can't tell once you start seeing drainage or smell. So those diabetes is a very big thing we have to really worry about.
What about athletic type things like plantar fasciitis and tarsal tunnel and?
So when it comes to plantar fasciitis, I always say there are different people, that can, get plantar fasciitis. Number one, if all of a sudden you have increase in activity, right? You used to walk 1 mile, also you're walking 10 miles. The foot, it shocks the foot, or some increased activity, then too, weight gain too, right? Because if you increase in weight, now the foot is not used to the amount of weight it has been carrying before.
Interesting.
And so sometimes that can lead to plantar fasciitis. Your foot type too can lead to plantar fasciitis. If you have a flat foot, if you have a high arch foot, those can lead to plantar fasciitis. So what can you do? When you have plantar fasciitis, the first thing is stretching. The good thing about plantar fasciitis is greater than 90% with people with plantar fasciitis get better. Not everybody needs surgery. So in such a situation, stretching, icing, inserts, good shoes. So long as you're compliant with those things, the plantar fasciitis will go. There are patients that come like, doc, this appointment was booked 2 months ago, but my pain is gone. I was like, this was an easy one.
There you go. Check it out.
Yeah,
The win column.
it's like they've been stretching, you know. You know, and actually my athletic patients are usually the best because they already know everything. They start telling me my job, like, you know, I'm like, you know, I think you're fine now. You know.
That begs a question when you said that. So if someone needs to get into you, what is your lead time on being able to get in?
So it depends. So sometimes it's based on how emergent it is, you know. So if someone is trying to get in for plantar fasciitis, I think right now we might be booking, again, they might correct me in the hospital, like probably 4 to 6 weeks for plantar fasciitis. If it's something like, let's say, like a wound, most times we try to get them as soon as we can.
Oh, good. That's good for people to know.
Correct. Yeah, and if we can, what we do is every infection or concern for osteomyelitis, which is bone infection, the ladies at the desk let me know. So we can go one of two ways. I can either speak to the primary care provider to see, because they had seen, it's like, oh, this patient just came in and, well, it's just for infection. And I said, okay, let's see if we can see them within 24 to 48 hours. If we cannot, then the next option is for them to go to the emergency room right away. And then I could come see them at the emergency room.
Perfect.
Yeah.
We are, believe it or not, we are down to less than a minute.
Oh, wow.
So if we could put this screen up that shows how to connect with Dr. Odigie, we have the phone number and the location. Then we'll know. Then everyone will know exactly how to get an appointment.
But while we're waiting for that, thank you so much for coming.
Oh, thanks for letting me.
Great meeting you.
Hopefully, you guys invite me back.
We will, because we're fascinated. We're absolutely fascinated.
All right,
Although
there
that's
we are.
Sevka. Oops, that was last week's show.
Last week's show.
Anyway, call Springfield Hospital, Office of Podiatry. Unfortunately, this time I didn't write it down.
All right.
But you're in the Ridgewood Professional Building.
Level 3. I think it's called 8C. Yes,
Level C.
yeah.
Okay, awesome.
And that's it for this week. We'll see you next
Thank
week
you,
on the
community.
feed. Bye.
Bye.
Right.
Thank you so much.
See how quickly that
That
goes?
was so